Hi, this is Governor Asa Hutchinson. Everyone deserves an opportunity to engage in healthy, active lifestyles. As governor, I support initiatives that are helping Arkansas become a healthier state. A healthy Arkansas lowers medical costs, attracts industry, and more importantly, improves the quality of life for all of us. The first step in achieving a healthy, active Arkansas begins with knowledge and continues with personal responsibility. Together, Arkansas State University's College of Nursing and Health Professions and College of Media and Communication have teamed up to produce a series called Your State of Health. These programs will discuss the health issues facing our state and provide information on how you can take control of your health. Arkansas is a great place to live, work, and play. We can all be working together to help people to feel better about their lives, reduce healthcare costs, and be better as a state. Now let's start focusing on creating healthy, active lifestyle opportunities for everyone.
Welcome to Your State of Health. I'm Kirsten May. Your State of Health is a series of programs designed to improve the health of Arkansans by providing you with information to create a healthy, active Arkansas. Today's program will focus on physical activity. We're joined by Dr. Shawn, the Chair of Physical Therapy at Arkansas State University, Dr. Tracy Morrison, Chair of Occupational Therapy at Arkansas State, Dr. Stacy Waltz, Chair of Clinical Laboratory Sciences at Arkansas State, and Dr. Latoya Green, an Assistant Professor of Physical Therapy at Arkansas State. Welcome to the show, guys. And Dr. Drake, we're going to start with you. How much does obesity cost us as a state each year?
Approximately $1.25 billion every year for just obesity-related health issues, and that is huge. And I think that if we can reduce that even by 5%, if we can reduce the body mass index, which is kind of the indicator of how much you weigh, in a sense, we can actually reduce the amount of money that we spend by about $2 billion every 10 years.
And some of us may have heard about the term population health, but Dr. Waltz, you're going to explain what is population health?
Well, certainly. I think of it as viewing the health of not just a single individual, but an entire community or entire population of people. And sometimes that also brings into the mix changing laws or the way the community is laid out or how insurance payments work. One of the best examples I can provide would be eliminating smoking in public places. That's a community health, a population health initiative in an attempt to reach many people in the community and make them healthier by not allowing smoking in public places. That's a good example. Certainly vaccination programs would fall under this purview of population health. And I call it rails to trails, but when you hear about old railroads being converted to trails to encourage people to get out and exercise, that would be another initiative that would fall under kind of a population health purview.
Okay, and you mentioned payment as one of those things. What is changing in the healthcare payment system?
Well, healthcare is moving more towards paying for prevention rather than treatment or cure. They're finding that the costs associated with preventing a condition or a disease is actually going to save a lot of money in the long run than waiting until somebody gets so unhealthy that they acquire that disease or develop that condition, and then we have to start paying for all of the treatment costs that go along with that.
So do you think the healthcare system will start promoting exercise and physical activity as a clinical prescription, I guess?
Yeah, I kind of do look at it a little bit like a prescription. We think a lot about all the different pills that are prescribed to treat certain conditions, but honestly, exercise is kind of that magic pill. And so knowing that exercise can stave off so many different conditions, and in many cases, even if you do develop a condition, being physically active and eating a good diet can actually reverse some of the conditions that people have developed. I don't see why exercise wouldn't be prescribed as your next best pill.
Okay. How much physical activity does a person normally need, though?
About 150 minutes would be the minimum. So if we can get individuals to exercise 150 minutes per week, we would probably help that population health overall. So we could reduce our cost that it costs in the state of Arkansas or within the nation by reducing the amount of medications that we're taking. So that 150 minutes seems to be the baseline. If we can get more, then even better, but we really need 150 minutes per week.
And is there different types of exercises that are recommended for different age groups, children in particular, adults, or anything like that?
I always recommend do what you like. If you don't like it, you're not going to do it. So some people do like to swim, some people like to run, some people like to walk. So what do you like to do? And then kind of focus around that. Some people will play tennis. So there's lots of different activities, but finding the one that you like is the most important.
Okay, let's talk about what moderate intensity aerobic activity is and why that's important.
Okay, moderate intensity is where you at least break a sweat. So there is some information that you need to get 10,000 steps per day. So it's great to get 10,000 steps per day, but if you never get your heart rate up, that really doesn't count towards your moderate activity of 150 minutes per week. So you need to get the heart rate up. You need to be able to break a sweat. So if you can break a sweat, then that meets that guideline.
And what if, you say you can't find 150 minutes, you don't have time, or can you do less? Can you break it up in smaller periods, or is it one big chunk?
Okay, you can break it up into smaller periods. You can do 10 minutes in the morning, 10 minutes at lunch, 10 minutes at dinner. So you can split the minutes up however you want. If you don't have 150 minutes, you can choose to do more vigorous activity. And so if you do more vigorous activity, you can do about half of that, 75 minutes as a minimum. So it's really a 1-to-2 ratio. So if you have 1 minute of moderate activity or vigorous activity, it's like 2 minutes of moderate activity.
And what qualifies as those vigorous activities?
This is the more difficult activities where you're really going to be breathing a little bit harder. It's not just about breaking a sweat, but you're going to be sweating when this is all done with. So, if it's the difference between playing tennis as a doubles versus a singles. If you play doubles, that's going to be more moderate activity. If you're playing singles and you're the one having to run after all of the balls, then that's going to be vigorous activity. So that would be an example.
And I think what Dr. Drake is saying is true, that you really want to think of it as a demand. We were talking about this yesterday together, and different personality types will gravitate towards different activities. I tend to like high intensity, in and out, done. Dr. Drake is more tolerant of a long burn. So if the two of us get together and exercise, we have to find sort of a happy medium. I can tell you I'll be bored within 25 minutes, and she may be able to go 3 or 4 times that. So then I know that I'm going to put the effort out for the time I'm doing it. There are also physical symptoms. One of the things that happens when you get your heart rate up is your brain fires chemicals. Your nose will start to run. That's a good example of sort of in that high demand place. And when your nose starts to run, or you sort of get a little nasally, you know that you're burning fat, and your heart rate goes up. Typically you break a sweat. And if you can even rev your engine up to that level where you feel that, you've already obtained the benefit. So once I sort of get to that point, I know I've accomplished my goal, and then I'll hang there for about 5 minutes and be done.
Well, and I would like to interject just a little bit about, talking about moderate activity and vigorous activity. Here we're talking about a population of individuals who haven't gotten maybe much activity at all. Mm-hmm. And so I always worry, as an individual who only within the past 5 years started to get into daily exercise and what have you, it's important to start very, very slow.
It is.
And because I worry about individuals who, here you talk about, say playing tennis and jogging, which is something I enjoy, but as somebody who has really never been physically active, we have to be careful about what we are requesting that they get started with. And so I honestly, I feel like some folks who maybe haven't been active much at all, starting with simple 10-minute walks perhaps around their work building or around their neighborhood or something like that might be a good way to just start to ease into it, because going right into something like CrossFit or tennis matches and stuff like that might cause injury. It also might make them maybe not enjoy what they're doing and then quit. So that's just something I wanted to interject in there.
And it gets back to, again, sort of the internal signals. So you have physical signals, which is higher respiration, right? Sweating, sort of feeling, it doesn't, even if you don't have or haven't been in shape before, if you do something that maybe wouldn't be high exercise to another person, but is to you, your body's still gonna respond that way. And a lot of times we do perceived exertion. So what is your perceived exertion? And really staying mindful of that. Again, fitness is a highly personal thing that you can be quite creative with. So you have to, though, stay in tune to how you're feeling the entire time and give yourself permission to stop when you've reached your max.
Absolutely. And I think it is important to say that it is individualized, and how somebody responds to even walking. Somebody walking down the hall, that may be all the activity that they can do in that 5-minute period. Whereas for someone else, that's not even getting their heart rate up 5 beats. So it is relative, and it goes back to finding that what that individual likes to do and just starting doing it a little bit at a time, but gradually increasing that.
Okay, Dr. Drake, can you provide with some more information about muscle strengthening activities, some things people can do for that?
We always think about going to the weight room, and it doesn't have to be a weight room. It can be things that you have in your own house. You can use a can of soup, for instance, to begin. That's something very light, and just start moving that, okay? Just doing some bicep curls or pushing it overhead. So it doesn't have to be quote-unquote weights. You can do things with your own body weight, such as squats. Just squat down from a chair and stand back up. You do that 50 times in a day, and I promise you'll get stronger. You can do push-ups, you can do wall push-ups. So there's lots of activities, and if you're not really sure, then go and find somebody to do personal training. Even as an initial session, a couple of sessions, it is worth it when you're talking about your health to talk with somebody about the right way to do it.
Okay, and I know most people that I hear talk about exercising, it's like another chore that they have to fit into their day. Dr. Green, is there ways that you can, I guess, go about exercising or get that mindset changed?
As you just said, it's a mindset. Mm-hmm. So it first starts with behavioral change. So you first have to know that that's something that you want to do, is to get healthier and just to get more fit. So it has to be a mental thing initially. So that person has to start by just saying, okay, I want to exercise. Secondly, they have to also think of all the benefits that actually go along with exercise, such as being able to rest better at night, being more alert, and just being physically healthy. So those are just a few things, more so that mindset initially, and then you have to, as Dr. Drake said, find things that you actually enjoy doing. So I can tell you now, walking on a treadmill bores me to death. So I actually enjoy using an elliptical, doing exercise videos at home, and actually that does get your heart rate up, and you're in that moderate to maximum intensity. Another thing, dancing. A lot of people don't feel as if dancing is exercise, but it actually is, especially if it gets your heart rate up or you're exercising at the intensity that you need to.
And I know one way that might motivate people is, exercising with other people. Can you tell me some about community-based exercise programs?
Okay, so with community-based exercises or exercise programs, as Dr. Waltz said earlier, there are things for people who are actually working. So employers actually offer incentives to, well, insurance companies offer incentives for their employees, and also free gym memberships and discounts. But I would kind of like to focus on the elderly population, those who actually are retired and don't work. So in the state of Arkansas, there are actually 2 programs that provide this, they actually promote physical activity and physical fitness. One is the Silver Sneakers program, and the other one is called PEPI. So it stands for peer exercise programs that promote independence. So with the Silver Sneakers, it's actually a program. You can find both of these programs in recreational facilities, gyms, and also senior living communities. And both of the programs focus on just, aerobic activity, aerobic training, flexibility, strength training, endurance, and again, it's with the elderly population. For Silver Sneakers, it's through your insurance, and it's more so the Medicare population, or the population who's a part or has Medicare. And there are actually 5 insurances in the state of Arkansas that provide these services through Silver Sneakers. And those insurance companies are Arkansas Blue Cross and Blue Shield, Humana, WellCare, AARP, and Coventry health plans. So those are all insurances that really promote and health and wellness and prevention, which, as we heard before, is very prime and very well needed in this state.
Well, and to piggyback off of what you're saying, you're talking about programs for the older population, and there's no shortage of programs or opportunities for adults and young adults and that sort of thing. A lot of times it's just a matter of maybe getting in touch with the local store that sells fitness equipment, shoes, etc. Here in Jonesboro, Gearhead Outfitters is one of the go-to places for that kind of information, and there's no shortage of, say, Couch to 5K type programs. If you really want to get to that point where you are going to be able to run 3.1 miles without stopping, Couch to 5K program literally takes you from off the couch to being able to do that. And then, there's women can run and girls can run type of programs, that sort of thing, and other opportunities. Some of the parks around town, not just here in this community, but in others, are starting to implement or install little fitness stations throughout, the walking or the jogging area, to encourage folks to come out and not only walk around or jog around, but to also then stop at these stations and maybe do some of the exercises that are recommended there. So there's no shortage of free and easy ways to become more fit and have the accountability piece of a group. You're always going to be more likely to get out there and do something if you know that your friends are waiting for you. I mean, it's what gets me out of bed every Saturday morning. I don't know about anybody else, but
Well, and I think it is important to have a buddy. That's finding somebody to meet in the mornings for me. I get up at 4:45 in the morning, and I can tell you I'd like to turn off the alarm some mornings, but I know that I have somebody waiting on me that's expecting me to be there. So I'm almost always there, almost always. But it's a choice. It's a choice that I make. I don't have to make that choice. I can choose to turn off my alarm and say I don't have time, I'm too tired. And I'm always tired at 5 o'clock in the morning. It doesn't matter. I'm always tired at 5. So it's a conscious decision to say I'm going to do this, and this is how I'm going to put it into my world, my life. And once you make that decision, whether it's at morning, afternoon, lunch, you've got to find those buddies to keep you accountable.
Why would someone want to become physically active if they haven't before? What are some of the health benefits that they'll see?
There's lots of health benefits, and we talked about the exercises, medicine, so to speak, and that it is the one pill that can help alleviate a lot of problems. We have, decrease in cancer rates, such as colon cancer, decrease in cardiovascular problems, decrease in obesity, decrease in diabetes. It improves your mental health. There's lots of improvements in mental health, and some of the research shows that it's better than taking a pill for anxiety. So taking the medicine of exercise is important.
And you talked about mental health a little bit. Dr. Morrison, you're going to talk to us more about how exercising can help people emotionally.
So the thing about exercise that I like to explain to my clients and to my students and colleagues is that if you kind of think about the way a car revs up and the engine sort of cleans up, the mechanism of exercise or getting your heart rate up actually serves to sweep your central nervous system. So your central nervous system is your brain, your spinal cord, how you react to stress, how you feel emotionally. So when you tap into the high heart rate, the sweating, even with low exercise, if you've been out of shape, you'll experience that. It serves to sweep your entire central nervous system of stress hormones that result and lead to things like Alzheimer's disease, diabetes, depression, Parkinson's. And so from that perspective, the benefits of exercise in terms of combating neurological conditions is completely robust. The benefit in terms of emotional health is also very well documented, studied. There's lots of evidence. And I want to just sort of reframe what we've been talking about. When you think about exercising at 5 in the morning, I think to myself, that would make me feel sad. I don't want to do that. I would feel bad, and I can promise you I would not do it over time, even if I had a friend waiting who would only be annoyed with me, and then our friendship would be damaged. So I like to think about exercise, and how I explain it to clients is it is a time to play. Exercise is the adult's opportunity to play, and really identifying what is your play. Is it gardening? Is it riding horses? Is it going on a walk? Is it going on a run? Is it mowing your lawn? There are many, many different ways to play, right? And I think in our society, children, and this sort of segues into another topic, and if you think about school, we make our children have recess, right? And the old sort of cultural idea around recess is to get their energy out, right? But the reality is that there's actually no evidence that children have more energy than adults. So the concept that children need to get their energy out really kind of points to the concept that we intuitively knew children need to play to feel situated and to focus and concentrate and to feel good. As we get older, we have choice, right? So I think a lot of times adults get out of balance with their choices. So as we get older, we have more stress, more things on our backs, and the opportunity to make a choice means that we automatically take play off the table, right? So I like to think about exercise as a commitment to self. How are you going to play? Do you only have 10 minutes? Do you only have 20? Do you only have 5? What is your play? And oftentimes as individuals go through life and their life changes, they experience different factors that alter their play. So I think it's really important to understand that exercise can benefit your emotional health and your physical cognitive health, your thinking abilities, and then find out what you like to do, and then you experience the true mental health benefit.
And I know you talked a little bit about children. Is there an age group that benefit more emotionally from exercising?
You know, we really don't know that. What we know is that right now we've come to realize that exercise provides optimal benefits in mental and psychological health for adults, and that we tend to deprioritize it when we only think about it as a physical benefit. We know that children experience a feeling of happiness after recess, but there's really not any studies around the difference across lifespan in terms of quality of life and emotional health in the age groups. So I think that as we start to explore exercise more as an outlet of play and enjoyment and quality of life and emotional health, we'll start to investigate comparisons across the age span. Again, hormones change, right? And so as children move into adolescence and then into their young 20s, their hormones go out of control. And exercise can really help baseline or keep those hormone levels more even.
And this last question can be for anyone, but what can you do in your community to help others be more physically active and really promote physical activity?
I think being involved at the community level. We were talking about some of the, Rails for Trails, and being an advocate for that and being involved with your city council. So what is going on in your community?
And then I would say for the more introverted individual, being an advocate for yourself, right? Really giving yourself permission to identify what makes you happy and making a commitment to experience happiness through exercise in some form for small portions of your day.
Well, and just as my 2 cents on that as well. And again, I think this is also related to the fact that I'm relatively new to the whole daily exercise thing. I try to give back by, and I'm more extroverted, I try to give back by encouraging others directly, inviting them to come with me to, an exercise class, or inviting them to come on a group activity where they're going to get outside and maybe break a sweat a little bit. And because a lot of times it's that personal invitation that increases their comfort level with starting something new and unfamiliar, and so to have that personal invitation to join somebody who maybe kind of knows the ropes and to join in, and they usually discover that it's quite fun and they want to keep doing it, and it's usually just that first step that they need to make. So encouraging others personally, I think, is important as well.
Of course.
Well, and I think, with the community and sidewalks, I know sidewalks has always been an issue. And what was interesting, Dr. Waltz is from Wisconsin, and I actually went to Wisconsin for a trip one day, and I was watching these kids walk to school. And I mean, there were loads of kids walking to school, and I thought, that does not happen in Arkansas. I mean, you might see 1 or 2 kids walking, but I mean, there were lots of kids walking to school. And so that makes you think, what are we doing? And we need to make safe environments for our kids and have sidewalks for the kids as well.
Absolutely.
Yes. And just quickly, to kind of piggyback off what Dr. Drake was just saying, there are means for doing that. So the Institute of Medicine, they're working on initiating programs in different states to have safe havens for students to walk to school and get more physically active. Another thing, know the resources that are there. So if you're interested in any state government funded programs, you can actually go to a website, www.healthy.arkansas.gov, to see what resources are available to you in your community.
Okay, well, thank you all for joining me today and talking about this. I think we've learned some really valuable things today. And that's it for this episode of Your State of Health, but make sure to tune in next time. Until then, I'm Kirsten May.